Welcome to our important discussion today. We're talking about a topic that touches many families and individuals: depression and anxiety in seniors. It's a common misconception that feeling sad or worried is just a normal part of getting older. But that's not true. Depression and anxiety are real medical conditions that can significantly impact a senior's quality of life. And importantly, they are treatable. In this comprehensive video, we will explore why these conditions develop in later life, how to recognize their often subtle signs, and most importantly, what practical steps, both at home and with professional help, can be taken to manage and alleviate them. Our goal is to provide you with clear, empathetic, and actionable information to help yourself or your loved ones navigate these challenges with hope and understanding. Before diving deeper, let's clarify what we mean by depression and anxiety in the context of older adults. It's crucial to understand that these are not just feelings of sadness or worry that pass quickly. Clinical depression, or major depressive disorder, involves persistent feelings of sadness, loss of interest or pleasure, and other symptoms that last for at least 2 weeks and interfere with daily life. For seniors, depression often manifests differently than in younger adults. They might not express overt sadness, but instead complain of physical aches, fatigue, or memory problems. They might seem irritable, withdrawn, or simply lack motivation. This can sometimes be mistaken for normal aging or even early dementia, which makes diagnosis challenging. Similarly, anxiety in seniors isn't just everyday stress. Generalized anxiety disorder, for example, involves excessive, uncontrollable worry about various aspects of life, often accompanied by physical symptoms like restlessness, muscle tension, and difficulty sleeping. Seniors might develop specific phobias, like a fear of falling, or experience panic attacks. The key difference from transient feelings is the persistence, intensity, and impact on daily functioning. Understanding these nuances is the first step towards effective support. Recognizing that these conditions are distinct from normal aging is vital for both individuals experiencing them and their caregivers. They are not character flaws or a sign of weakness. They are health issues deserving of attention and treatment. This understanding paves the way for a more compassionate and effective approach to care. Now let's delve into the complex question of why depression and anxiety occur in older adults. It's rarely a single cause, but rather a combination of factors: biological, psychological, and social. On the biological front, chronic medical conditions play a huge role. Diseases like heart disease, diabetes, stroke, Parkinson's disease, and even certain types of cancer can directly contribute to depression and anxiety, both through their physical impact and the emotional burden of living with them. The pain and limitations these conditions impose can be devastating. Furthermore, many medications seniors take for various conditions can have side effects that mimic or cause symptoms of depression and anxiety. Polypharmacy, the use of multiple medications, increases this risk. Changes in brain chemistry, sometimes linked to conditions like dementia or other neurological issues, also play a part. Nutritional deficiencies, such as low B12 or vitamin D, can also impact mood. Psychologically, seniors often face profound losses. The death of a spouse, siblings, or friends can lead to deep grief and isolation. Loss of independence, whether through reduced mobility, vision, or hearing impairment, can be incredibly difficult to accept. Retirement, while often anticipated, can sometimes bring a loss of purpose, routine, and social connections previously derived from work. The fear of cognitive decline, the stress of financial insecurity, or even the feeling of being a burden to family can all contribute to psychological distress. Socially, isolation is a major culprit. As friends and family move away or pass on, social networks shrink. Living alone, reduced opportunities for social interaction due to mobility issues or even technological barriers can lead to profound loneliness. Financial strains, especially for those on fixed incomes, can cause immense anxiety. The role of a caregiver, while rewarding, can also be incredibly stressful and isolating, sometimes leading to depression in the caregiver themselves. Abuse, whether physical, emotional, or financial, is a tragically overlooked cause of severe distress. Major life transitions like moving from a familiar home to an assisted living facility can also trigger anxiety and depression. Understanding this multifaceted web of causes is vital because it informs a more comprehensive approach to prevention and treatment. Recognizing the signs of depression and anxiety in seniors can be challenging because they often present differently and can be masked by other conditions or simply attributed to old age. Let's look at the key symptoms. For depression, instead of overt sadness, you might see a lack of interest or pleasure in activities they once enjoyed, a persistent feeling of emptiness or apathy. Irritability, rather than tearfulness, is common. There might be changes in appetite, leading to weight loss or gain, and significant sleep disturbances, either sleeping too much or struggling with insomnia. Seniors might complain of persistent fatigue, aches and pains that don't respond to treatment, or memory problems and difficulty concentrating, which can be mistakenly attributed to dementia. Social withdrawal, neglecting personal care, and increased reliance on others are also red flags. For anxiety, watch for excessive and uncontrollable worry about everyday events, health, finances, or safety. They might seem restless, keyed up, or constantly on edge. Physical symptoms such as muscle tension, headaches, stomach problems, or shortness of breath are common. Specific phobias like a debilitating fear of falling or leaving the house can emerge. Some might experience panic attacks, characterized by sudden, intense fear, heart palpitations, sweating, and a feeling of losing control. It's also important to note overlapping symptoms. Both conditions can cause fatigue, sleep problems, difficulty concentrating, and somatic complaints. The key is observing persistent changes in behavior, mood, or physical health that significantly impact their daily life and functioning. If you notice these signs, it's a signal to seek professional evaluation. While professional help is often necessary, there's a lot that can be done at home and through lifestyle adjustments to support mental well-being in seniors. Let's explore some effective strategies. First, physical activity. Even gentle exercises like walking, chair yoga, or light stretching can significantly boost mood, improve sleep, and reduce anxiety. Encourage short, regular bursts of activity tailored to their capabilities. A daily walk, even for 15 minutes, can make a difference. Second, nutrition. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support brain health. Limiting processed foods, excessive sugar, and caffeine can help stabilize mood and energy levels. Hydration is also key. Third, social engagement. Loneliness is a powerful contributor to depression. Encourage regular interactions with family and friends. This could be phone calls, video chats, or in-person visits. Joining community groups, senior centers, or volunteering can provide a sense of purpose and belonging. If mobility is an issue, look for online social groups or programs. Fourth, mindfulness and relaxation techniques. Simple practices like deep breathing exercises, gentle meditation, or progressive muscle relaxation can help manage anxiety and promote a sense of calm. Hobbies like reading, gardening, painting, or listening to music can also be therapeutic and provide mental stimulation. Fifth, sleep hygiene. Establishing a regular sleep schedule, ensuring the bedroom is dark, quiet, and cool, and avoiding screens before bed can improve sleep quality. Napping too much during the day can disrupt night sleep. Finally, maintaining purpose and routine. Having a daily routine provides structure and predictability, which can be very comforting. Encouraging seniors to continue hobbies, learn new skills, or take on small responsibilities can foster a sense of purpose and value. These lifestyle changes, when implemented consistently, can lay a strong foundation for better mental health. When home remedies and lifestyle changes aren't enough, or when symptoms are severe, professional medical solutions become essential. It's crucial to know when to seek help. If symptoms persist for more than 2 weeks, interfere with daily life, or if there are thoughts of self-harm, immediate professional attention is warranted. The first step is usually a comprehensive medical evaluation by a primary care physician. They can rule out underlying medical conditions or medication side effects contributing to the symptoms. Often, a referral to a mental health specialist, like a psychiatrist, psychologist, or geriatric counselor will follow. Therapy, your psychotherapy, is highly effective for both depression and anxiety in seniors. Cognitive behavioral therapy, or CBT, helps individuals identify and change negative thought patterns and behaviors. Interpersonal therapy, or IPT, focuses on improving relationships and addressing social isolation. Group therapy can also be beneficial, providing a supportive environment and reducing feelings of loneliness. Therapy can be adapted to suit a senior's cognitive abilities and pace. Medication is another important treatment option, especially for moderate to severe cases. Antidepressants, particularly selective serotonin reuptake inhibitors or SSRIs, are often prescribed. For anxiety, certain anti-anxiety medications may be used, but caution is paramount due to potential side effects like drowsiness, dizziness, and the risk of falls or cognitive impairment in older adults. When home remedies and lifestyle changes are not enough, or when symptoms are severe, professional medical solutions become necessary. Knowing when to seek medical attention is crucial. If symptoms persist for more than 2 weeks, interfere with daily life, or if there are thoughts of self-harm, immediate professional attention is essential. The first step is usually a comprehensive medical evaluation by a primary care physician. They can rule out underlying medical conditions or medication side effects contributing to the symptoms. Often, a referral to a mental health specialist, such as a psychiatrist, psychologist, or geriatric counselor, will follow. Therapy, or psychotherapy, is highly effective for both depression and anxiety in older adults. Cognitive behavioral therapy, CBT, helps individuals identify and change negative thought patterns and behaviors. Interpersonal therapy, IPT, focuses on improving relationships and addressing social isolation. Group therapy can also be beneficial, providing a supportive environment and reducing feelings of loneliness. Therapy can be adapted to the older adult's cognitive abilities and pace. Medication is also an important treatment option, especially for moderate to severe cases. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, are often prescribed. For anxiety, specific anti-anxiety medications may be used, but caution is paramount due to potential side effects such as drowsiness, dizziness, and increased risk of falls or cognitive impairment in older adults. Dosages for older adults are typically lower and increased very slowly, following the start low, go slow rule. In some cases, other interventions such as electroconvulsive therapy, ECT, or transcranial magnetic stimulation, TMS, may be considered, especially for severe depression that has not responded to other treatments. The importance of a comprehensive team approach cannot be overstated, where doctors, mental health professionals, and family collaborate to create the best care plan. Supporting loved ones in attending appointments and adhering to their treatment plan can play a vital role. Remember, regular follow-up and patience are key components of successful treatment. Treating depression and anxiety in older adults is a process and may require adjustments over time. While we've discussed management, let's also focus on prevention. Proactive steps can significantly reduce the risk of developing depression and anxiety in later life. First, maintain a healthy lifestyle throughout your life, or start now. Regular physical activity, a balanced diet, and adequate sleep are foundational. Second, foster strong social connections. Actively participate in family life, community activities, and friendships. Loneliness is a silent epidemic, and combating it is a powerful preventive measure. Third, keep your mind active. Engage in lifelong learning, puzzles, reading, or hobbies that challenge your brain. This can help maintain cognitive function and a sense of purpose. Fourth, plan for life transitions. Discuss retirement, financial planning, and potential living arrangements well in advance. Having a plan can reduce anxiety about future changes. Fifth, regular health checkups are vital. Address chronic medical conditions promptly and review all medications with your doctor regularly to identify potential mood-altering side effects. Finally, build resilience. Develop coping strategies for stress and loss throughout your life. Learning to adapt to change and cultivating a positive outlook can be incredibly protective. Remember, prevention is about empowering yourself and your loved ones to live full, emotionally healthy lives well into old age. As we conclude, remember that depression and anxiety are not inevitable parts of aging. They are treatable conditions, and seeking help is a sign of strength, not weakness. We've covered the complex causes, learned how to recognize the subtle symptoms, and explored a range of effective solutions, from lifestyle changes to professional medical interventions and proactive prevention strategies. If you or a loved one are experiencing these challenges, please reach out. Talk to a doctor, a trusted family member, or a mental health professional. Support is available, and a better quality of life is absolutely possible. By understanding, empathizing, and taking action, we can help ensure that our senior years are filled with dignity, joy, and emotional well-being. Thank you for joining us today.